rid of that pooch.
Oh, yeah.
Is it pooch?
It's a
Is it a pooch?
It's a pooch.
It's a little pooch.
Yeah.
Those unwanted love handles, perhaps?
Heather Lake is in Solana Beach with a machine that melts the fat away.
So we all wish that it was sweater weather already, but too bad, because in San Diego, it's always time for your bikini. And now we have a way to get that last 5 pounds or couple of inches off your waist, maybe even your thighs, maybe your arms, and it doesn't hurt. You know, a lot of people do liposuction, Dr. Melanie Palm, to get rid of some of their unwanted fat. But now there's this thing, and you say that Vanquish, which is this machine here, is just like a warm blanket.
It is. So it's radio frequency, and what that does is it selectively heats up the fat layer. That's it, not the overlying skin, not anything underlying it. Heats it up to a certain temperature that some of the fat cells are unhappy, and they undergo what's called apoptosis, which is controlled cell death, and it gets eliminated by the body permanently.
So how long does this actually take? She's going to sit here for 30 minutes, and then they're just gone, and you get up and you say, oh, I'm skinny now.
Yeah, I mean, the process takes several weeks. So we see usually patients once a week for a series of 4 treatments. Results are usually seen about 2 months out, and they're, you know, depending on patients just adhering to normal diet and exercise, it's permanent. So in our study, when the thigh was done, people lost an average of about 1 inch. So this is a new applicator that came out just in the last year, so called the Flex applicator. We can use it for the inner and outer thighs. It actually moves, so
wow.
It tailors to the patient. And we can also use it on upper arms too, which has been a popular area to treat.
And I love how she's just hanging out there. There's no loud noises. There's no nothing going on. It's just almost like the machine's not even on, but you're feeling just a little bit of heat?
Yeah, just a little bit of heat. Nothing, no pain, no nothing.
Sounds like it's too easy, like almost on your lunch break. She could literally be sitting there having her salad and then go back to work.
And I know the old adage, if it sounds to be too good to be true, then it probably is. But this, I think, is an exception to that rule. It really just feels like a warm sort of blanket over the area of the leg. Patients do it often over the lunch hour, like you were saying. They can walk in, walk out, and then slowly and gradually over time they look better in their clothes and bathing suit.
Yeah, I mean, in some of these problem areas, depending on what your genetics are, you're just not going to get rid of certain thighs, certain belly, which we want to mention. Let's show this piece. So this is the piece that goes over your stomach. So you basically can just change it out, put it over your stomach, and then we also have before and after pictures of some people that had some really great results.
Yeah, so this is, you know, the original applicator. It's sort of U-shaped, and it fits over the flanks and treats the tummy simultaneously. So that's really nice. It's a large surface area to actually treat for unwanted fats. We'll actually show a couple before and afters, and those patients did great. They were in one of our clinical studies that we conducted here at the clinic, and patients lost an average of about 2 inches. One of the patients, she was closer to 4 or 5, and now she's a fitness model.
Good for her. You know, sometimes diet and exercise will only get you so far. So I think that if you're doing the right things and in the right direction, you're a candidate for this. You know, if you still got a little ways to go and you're eating, you know, the burgers, the fries, and not doing the right thing, this probably isn't going to work for you, right?
We never want patients to think of this as some sort of body contouring device if they're just not adhering to good sort of healthy habits. So for patients that are active, that they have stubborn areas, I mean, this is just sort of genetically inherited, then I think that's when you consider something like Vanquish.
Dr. Melanie Palm at The Art of Skin, thank you so much. For more information on Vanquish, go to our website, fox5sandiego.com. All you have to do is click on that Scene On tab. For now, I'll send it back to you guys in the studio.
Heather, thank you.